again we are back on ttalk, Soch ki train of thought with a series of episodes with Dr. Vishwanathan Iyer. He is a chief neurosurgeon and managing director with Qualilife and also an cycling mayor of Mumbai and also deals in brain and spine. So welcome back to this episode. It's a great insight. So what we are getting for target audience in knowing about new neurosurgery in journal and also in terms of in brain. Yeah. And now coming to a spinal cord, like it's basically which again forms an important part of a body life. And maybe I think since you are a cyclist and you had an experience and on day-to-day life also, like when we talk in terms of a spine, it's a backbone of everything. Correct. Like so for the benefit of a target audience, can you talk about anatomy of a spinal cord for a target audience so they can know what spinal cord is all about?
Fine. So if I may put it in a very normal language, the spinal cord is the highway which connects your brain to your peripheral organs. Mm-hmm. So the signals which come from your brain, if they have to reach, so if I have to move my toe, the brain will tell me to move my toe. Correct. But the spinal cord is the one which conducts the signals from the brain to my nerves in the periphery, and that's when my toe moves. So the spinal cord is the highway which connects the both. So what we normally hear, the spinal bony column. So there is a spinal bony column. So there is a cervical, there is a dorsal, there is a lumbar, and then there is a sacral. So that is the bony column, and inside which is the spinal cord. The spinal cord is probably just the size of my finger. So it's just about this size, but that contains a very high packed neurons, and those neurons communicate the signals from the brain to the periphery. So, and because of the importance of the spinal cord, it is given a well protected bony cover all through by nature.
Correct. And many times I think as well athletes which are concerned, the weightlifter were concerned, like and maybe like lifting capacity may differ to certain extent. The impact first comes as far as the back injury which are concerned, like.
Yeah, I think this is also a very important now topic because this gym fad, if I may say so, has become very common. So you find every young man wants to go to the gym.
Correct.
Nothing wrong with going to the gym, but they also want to be really strong and beefed up in 6 months' time, which is not really the logical thing to do. So I have a lot of patients coming to my clinic even today because of gym injuries. So when you do a gym weightlifting exercise, you must make sure a few things. One, of course, it has to be gradual and graded program. You can't straight away start lifting huge weights on day one. Second, the posture has to be maintained well while doing the gym weight programs. And third, you must focus on breathing. I think if you are not focusing on breathing well while carrying weights, and that's when leads to injuries. And many of the low back spinal injuries tend to have a very long chronic kind of a behavior. So it may lead to a difficulty of your normal activities of daily living. So I think it is my suggestion to everyone who goes to the gym to be patient and to do the gym work in a very gradual manner, so that you do make up a good body, but you don't get injured in bargain.
And even many of them professional athletes or in player, like many cricketers, like who have gone back injury and all, and then again like just with Bumrah, like again is more active now. So what advice would you like to give to the athletes, like
I think because of the spinal column having to take the weight and the brunt of the whole body, repeated injuries, especially in sports people, do happen. Okay, so the ways to avoid it are, of course, everybody probably is aware of that. Before you start a sporting activity, you must stretch. So you must have a warm up, then you must do activity. After the activity is over, again you should have a cool down session. You should stretch your muscles which are sore. So these things also for the back are important. So normally we may focus on a hamstring or a calf muscle stretch, but we forget about the back.
Correct.
So concentrating on the spinal column and is also very important. Injuries can be very well managed with a combination of treatment. So for spinal cord injuries now, or rather not for spinal cord, but for spinal column injuries, there are lots of things available, and most of the treatment is going to be non-surgical. So a patient who comes to me with a spine problem, 90% of the times I will be giving him only medical care. which may involve medications for a few days, definitely physiotherapy, posture correction, how you should work in the office, how you should sit on the proper chair, how you should keep the hands on the armrest while working on the computer. So these kind of lifestyle posture changes lead to a good cure rate in most of the patients. So similarly for sportsmen also, I think most of them go through a very good rehabilitation program, and I think many of them come back to a good sporting career, even probably without having to undergo surgery.
Okay, now if we'll see like as far as this century which is concerned, many of us are very stressful, work from home culture is there, and those are doing only desk work, like so as far as the spine part which is concerned, so what is the advice you would like to give it to the working professional like?
I think it's like an epidemic now. So working IT professionals who are working on the computer the whole day, and with I think the challenges of meeting their targets and achieving their growth in their own career, they do forget certain things like proper ergonomic way of working, sitting properly, and now they say sitting is the next new sin. So you should probably not sit too long. So what I try to tell my patients who come to me is that, of course, everybody has to work. You have to deliver. You can't quit.
Correct.
So the thing is how you modify your working environment so that your back doesn't get affected. So the simplest things which can be done is that don't maintain the same sitting posture for more than an hour. So what I tell my patients is that even if you have to work for 15 minutes extra in the end of the day, after every hour, get up, take a small walk, go meet your friend, say hello, come back. So don't sit in the same posture for more than an hour. At the same time, intermittently you must stretch. You must move your hands and legs, because the neck pain and the neck stress of working on the computer too long is also very common. So, moving a little bit. So ultimately, I think taking a break of 30 seconds in every 1 hour is doable. It's just that we forget to do it. And that leads to problems. So simple things like stretching after 3-4 hours, getting up after every 1 hour, sitting properly, keeping your back erect and spine straight, not using the phone too often. All these things are simple solutions, and they can help for a good, healthy spine life.
But if we'll see today's generation, like the youth who are there, like they're more addicted towards like as for the mobile which are concerned, and even in family also, hello I think is only through WhatsApp. Hi, okay. So probably what kind of an injuries they can have, like they're too much addicted towards those kind of an using a gadget like.
I think, holding the gadget for too long, putting your neck down and continuously seeing and scrolling through the images leads to a lot of neck stress. And the neck stress can weaken your spine, and you may end up having a slip disc, which may end up having tingling or numbness or weakness in the hands. So I think, any posture for that matter is not supposed to be abnormal. You are supposed to maintain a posture which is a normal for your kind of an erect position. So I think using the mobile, especially people are now using mobile while sleeping on their bed. So that's also a very abnormal posture in fact. So I think if you really have to work on the mobile, you must invest in certain things like a mobile stand or something like that, because see, there are ergonomic things available to reduce your stress. So if you really have to sit on the mobile, I mean, I don't think I can get away by saying that mobile mat use karo, but if you have to, you better use ergonomic supports available.
Doctor, you spoke about slip disc, like if you look at the anatomy of spinal cord, like in slip disc, which is a like fold level which is more affected.
Okay, so see, slip disc is very simple. If I say in Hindi, it's a gadi sarak gaya. So gadi or disc is the soft jelly in between the two bones of the spinal column. So between every two bones there is a gadi or a like a jelly, and that's what helps you to be supple. So you can bend forward, you can bend backward, and that bending happens because you have interspersed jelly in between your spine. So because of certain abnormal activities or high pressure areas, that part of the jelly may come out of the normal confines, and that is what is called slip disc. And when that happens, then we push against the nerve, and the nerve which supplies your leg may get irritated, and that's when you have leg pain, numbness, tingling, and that is how you diagnose a slip disc. So this is commonly happening in the low back, the lumbar area. Occasionally, of course, it can happen in the cervical or the neck area also.
Many a times we have seen and patients like who are having this back problem at the initial stage, like where they cannot even get up for a couple of months from the bed, so how that's really painful,
Yeah.
so what you will advise for them,
These kind of acute severe back pains are more mechanical. So, it could mean just like a ligamentous injury in the spinal cord or like a muscle strain. Of course, slip disc also can be a contributory factor. So, previously the medical school of thought was that you give prolonged bed rest and things become better. But now the medical school also has changed its modality of treatment. So now if a pain patient comes to me with an acute severe back pain, I'll give him good painkiller medicines for the first few days. And we normally advise bed rest for only a short span of 3 to 4 days now. Because we have realized that keeping the patient on bed too long is also not going to help. So we give 3 to 4 days of acute pain relief, bed rest. Once that is clear, we may need to do an MRI to really know what's happening. And then he may be referred for physiotherapy, posture correction. And with these things, the patient does settle.
Good, doctor. I think it's an excellent insight to what you have given on spinal cord. I'm sure when we're talking about a stressful life, we all are running after the targets to meet our end, and many things we forget in the process,
Sure.
If the ttalk audience are listening to Dr. Viswanathan Iyer exclusively on ttalk Soch ki channel, I am sure the advice relevant to the spinal cord which are concerned, I'm sure it's going to be dangerous at a time. Maybe I think to take a precautionary measure, as rightly said, rather than being too addicted to the gadgets and maybe sitting in one place for longer, you need to really take and walk in between to ensure it's normally your body is relaxed to a certain extent and you can work for an extra hour also. This is what ttalk platform is all about, where the prominent personalities like Dr. Vishwanathan, they come and share their own experience and the piece of an advice so that the target audience enjoy meaningful learning. So thanks a lot for spending valuable time and letting our target audience with real great insights as far as spinal cord which are concerned.
Thank you so much.
Thank you very much. God bless.
Thank you.